All right, let's bring on that Children's National team. There they are. Good morning to Vivian, Clarissa, and Jill. Good morning, guys. So we are so excited to have you on. If you want to take a moment to just introduce yourselves, I'd love to just get a quick introduction before we get started. Vivian, you want to go first?
Hi, I'm Vivian Connetics, and I work at Heart and Kidney Unit at Children's National Hospital.
Wonderful. Clarissa?
Hi everyone, I'm Clarissa Chan Salcedo and I am informatics nurse here at Children's National.
Awesome. So excited to have you on. And Jill?
Hello, everyone. My name is Jill Board. I'm the lead nurse recruiter here at Children's National, and I have been a proud member of the children's team for over 30 years now, actually starting as a new grad on the Heart and Kidney Unit where Vivian now works.
Wow, well, that's amazing. Well, I think we are in for a treat. We clearly have a lot of experienced Children's National facility folk to talk about Children's National, so we are excited to hear about it. You guys got 10 minutes on the clock. You know the rules. Ready and go.
Well, hello, everyone. First, I'm going to share with you a little bit about Children's National. I hope everyone could see my screen. And here's a little video to tell you more about us here at Children's National.
Every day, every case, every new idea. Question. What's right for children? What's right for the youngest? The vulnerable? The most resilient? What's right for a future engineer? A rock star? A princess? A president? We believe what's right means that every child should be cared for by people who have devoted their careers to children's medicine. Whether in the OR, in the community, or in our hospital, you'll find them. Nurses, surgeons, researchers, educators, all with a lifetime of expertise and commitment. What's Right is a special place designed with kids in mind, a place focused on their unique physical and emotional needs, where some of the world's most innovative thinking is working to reimagine children's healthcare, where moms, dads, and siblings are as much a part of the care team as we are, and where lives are saved and lifetimes reclaimed. What's Right means raising a voice for those who cannot, championing the health of children in the nation's capital, across the country, and around the world, working so that every child, everywhere, has the best chance at a bright future. We are Children's National. Children's medicine is not part of what we do, it's all we do. Every day, we honor a mission that goes back a century and embrace a vision that goes forward just as far. We are protectors and guardians, stewards and advocates, visionaries and leaders, working with a single focus: to bring health and well-being to all children. We don't believe it's unreasonable, unrealistic, or unreachable. We believe it's just right.
So Children's National Hospital is a 323-bed acute care hospital. We have over 30 outpatient locations, and we are ranked in the top 5 by U.S. News and World Report. I'll show you a little video more about that. Children's National, we are a level 1 pediatric trauma center serving Washington, D.C., Maryland, and Virginia. We have our own critical care, ground, and air transport teams, and we're ranked 7th nationally for NIH pediatric research funding. We are located in Washington, D.C., and I am going to introduce now Virginia Ali, who is the co-founder and owner of Ben's Chili Bowl, which is a very iconic restaurant here in Washington, D.C., to tell you a little bit more about D.C.
D.C. is unique. We match other world-class cities pound for pound in dining, nightlife, arts, culture, theater, sports, outdoor activities, green spaces, and the list goes on and on. But nowhere else can compete with our monuments, our museums, and memorials. And no other city has as many free things to do. Add it all up, and DC's diversity of experiences is truly unmatched. There's only one DC.
So why choose nursing at Children's National? Why choose being a pediatric nurse? I'm going to have some of our nurses tell you why.
I love being a Children's National nurse because Children's National invests back to us through wellness programs so that we can continue giving our very best to our patients and families.
I became a nurse because I was once a patient and I had such great care in the hospital. It was fantastic. So I decided I need to do this for the rest of my life. Guess what? Here I am.
I chose peds because of the relationships I get to form with kids and their families.
I became a pediatric nurse so that kids can stay kids.
I love Children's National because I love to be a part of a child's healthcare team.
Why I love nursing? Because every time I come to work, I know I can make a difference. I'm making connections with diverse population and working with great teams such as nurses.
Hey, I became a pediatric nurse so that I can work with not only children, but also their families.
I love Children's National because I love watching our tiny patients overcome big obstacles and sending them home.
I love working at Children's because here my coworkers feel like family.
I chose pediatric nursing to make an impact that will last a lifetime.
I chose nursing to follow my mom and grandma's footsteps.
I like pediatric nursing because I get to send my kids home to be with their families.
That was just a few of our nurses and Dr. Bear telling you about why they enjoy pediatric nursing at Children's National. In addition to the benefits offered to all hospital employees, nurses at Children's National are offered some additional benefits, including unlimited continuing education, tuition reimbursement for academic advancement, tuition for certification classes and attendance at continuing education programs, monetary rewards for nurses receiving specialty certifications and academic advancement. We have our own nurse well-being program with a dedicated program manager, many opportunities to join our shared nursing leadership councils and becoming involved in that, a clinical ladder, and then, of course, a comprehensive compensation package, including shift differentials, critical care hourly premium, and charge nurse, preceptor, and float pay. In pediatric nursing, only in pediatrics can you save a lifetime. And now I'd like to turn it over to my colleagues, Vivian and Clarissa, to tell you a little bit more about their journeys here at Children's.
Hi, good morning. My name is Connetics, and I started my career as a ICU and ED nurse in the Philippines. And when I was recruited by Children's, I've a contract for 2 years. It's a big challenge for me because I don't like taking care of kids, and I don't like.
Oh no. Oh my gosh, guys. We ran out of the 10 minutes. I'm so sorry. That was so interesting to hear about Children's National. I want to give you a chance, Vivian, just to follow up. I would love to know, just tell me, why do you love working at Children's National? Give me like your top 3 reasons in 30 seconds or less.
Love working at Children's National because they helped me love children. Jill, in particular, was one of the persons that had helped me acclimate to kids and worked with me so that I could continue working at Children's. And I've worked there for 23 years. In Children's, you can influence it being in the national capital area, a number 5 pediatric hospital, and a magnet hospital. You can influence health and nursing situations, rules, laws, as big or as little as you want to. I started as a nurse tech, but now I'm a shift coordinator in a heart and kidney unit where I take care of hearts and
wow, Vivian, that's pretty amazing. Wow, it sounds like you have had quite the interesting journey. And it was so interesting to hear about Children's National. I mean, I was taking notes while you were going through that presentation. Top 5 by US News, magnet facility. I loved that video. I especially loved the nurses who said the coworkers feel like family, and Children's National really invests in its employees. I think that really speaks so highly, especially the 3 of you being there for so long, really speaks so highly to the love and care that Children's National has for its employees. So I'm sure all of our nurses who are watching around the world are so grateful for you taking your time to share about Children's National, and are very excited, I'm sure, to interview with Children's National. I mean, Washington, D.C., one of the best cities in the whole United States. Everybody knows it. So thank you, Vivian and Clarissa and Jill, for being on with us today. We really appreciate it. If you have any questions, the Children's National team will be answering in the chat, so feel free to put your questions. They'll be looking back through there. Thank you, Children's National team.